Hi, I'm Dr Martina Hodgson and I'm here to tell you 5 things that your dentist might not tell you about composite bonding. So composite bonding is a fantastic way to restore chipped, worn teeth or restore the size and shape of your teeth. However, there's some things you need to know before you go ahead with treatment. Number 1, composite bonding doesn't last forever. So on average, we say it lasts between 3 and 7 years. If you're looking for something more long-term, it might be better for you to explore other options, such as porcelain. Number 2, it can stain. So just like your own teeth, it can pick up staining from things like coffee, curries, red wine, all the things that we love. It's easy to polish off, but just remember you might need regular visits to keep it looking nice and shiny and white. Number 3, it's not bulletproof, though it can chip, and the best thing to do is make sure your teeth are straight to start with, which is why we often align teeth with something like Invisalign before we do composite bonding, so that the function and bite are all in the ideal position to give you the most life out of your composite bonding. Number 4, composite bonding is part science but part art, and just remember it can take years and years of practice to get really good at composite bonding, so it's not something that you can learn overnight. So just make sure that when you're choosing a dentist, you're choosing someone who's got lots of experience with composite bonding, and also have a look at their portfolio so you can see the quality of work and if their style suits you as well. Finally, number 5, so composite bonding is called reversible, but sometimes we do need to take away small amounts or prep some enamel before we start treatment to give you the best result. Also, when you come to have it removed, there is a chance that you may have some enamel touched at the same time. So it's just something to be aware of when you're thinking about bonding. So there you have it, 5 things that you might not know about composite bonding. So if you're still interested, just make sure that you choose the right dentist for the job. And remember to like and subscribe for more straight talking dental facts.